Hello, I'm Jorian Murray, and welcome to Good Things Happen, the show that invites changemakers and enablers to share their inspiring stories of progress. Whilst change can be uncomfortable, unexpected, and at times disruptive, it's inevitable, and more often than not, change is for good. We'll be hearing from people from all walks of life who have been at the forefront of change, including their journeys to get there and their motivations. Because when people work together for a common cause, good things happen.
Technology is an enabler, right? For all of us, and similarly for healthcare professionals as well, to make their life easier and better, so that they can treat their patients even better.
People who want to take ownership, every opportunity is there to live a longer, happier, healthier life.
In like 4 years, we are now a 220 people brand with network in 21 countries, offices in 4 countries, right? And growing at a very rapid pace, 3x year on year. Right? Shows that our solution is working, helping pharmaceutical brands, helping healthcare professionals get the right message at the right time.
Following the 2020-22 global health crisis, the World Economic Forum laid out its vision for global healthcare equity by 2035. 4 strategic areas were identified to support long-term change to achieve better health and healthcare around the world. Number 1, equitable access and outcomes. 2, healthcare systems transformation. 3, technology and innovation. And 4, environmental sustainability. Today, on Good Things Happened, I'm joined by 2 very well-informed guests to discuss what's happening in the world of health. Medical doctor and entrepreneur Dr. Harshit Jain, who is the founder and global CEO of Doceree, an innovative healthcare marketing platform that connects healthcare professionals with life science brands. My second guest is Global Head of Healthcare at Citi Commercial Bank, Nauman Ansari. As ever, let's start with your formative stories. Harshit, you go first. You wear many hats, but did you always think you were going to end up in a similar world to this, or did you want to be an astronaut when you were a little boy?
Thanks, Jorian, for inviting me to this show. And I'm still a young boy, so not very far. So for me, it was serendipity. I never thought I would do this. As I said, I'm a medical doctor by training, but last I practiced internal medicine was back in 2006. Like when I think about it, like it's been 18 years now, which makes me feel old, but I'm still young, and have done a lot of things. Created 2 startup businesses, one in technology, second in communication. Then spent a lot of time in advertising. I just follow my passion, and things just keep happening. That's what I've done all my life.
How about you, Nauman? What's your backstory?
Well, so Jorian, yeah, I sort of followed this path somewhat by accident, and you know how your life takes you at times. When I was a kid, I wanted to be call it the point guard for the New York Knicks, but that was pretty clear from a very young age that I had a 0% chance of that actually happening. And then
how tall are you?
I actually contemplated 5'9", so
okay.
Plus my athletic abilities average at best, right? So I had a few reasons, but I contemplated medical school myself, and I was actually on the verge of going down that path, and I just didn't. And it's funny how, sliding doors, as they say, right? And I went the business route, the business school route, and my career has been somewhat by happenstance, somewhat by design, quite healthcare focused over, well over 20 years. In a few different functions within banking, but covering the healthcare space for quite a while. And, I think it's fortunate, to a degree. I think it's one of the sectors that, it will always be there, right? There are people on this planet, and they're getting older, and there are more and more of them, and there's innovation, and there's investments, and it's an exciting place, an exciting space. So somewhat, good fortune, but very happy to be working in here.
Well, we're tackling a huge subject today. We're obviously not going to cover it all, but was the pandemic, was lockdown, do you see a huge change from before then and after? I mean, certainly as an individual, I can't imagine that we all thought of healthcare. We took it for granted almost in many ways. What's changed, if anything? Harshit?
Culturally, we are all very reactive people, right? And so if I see, has my life changed pre-COVID era and the post-COVID era? Not much now, right? Except very few things, which is not because of the pandemic, but because of, I think, convenience or other things which we have learned to do. Right? But when it is about focused around healthcare, I think we just want to forget those 2 years, what happened. We don't want to talk about it, right? Instead, right, I know there are government authorities, institutions who are drawing learnings from what really happened and how can they do better. They never imagined they could release a vaccine, like a new vaccine in such a short span of time. Whether it was good, bad, no one knows, but at least it helped in addressing the challenge at that point of time, because everyone thought the world is going to end because there was no control.
Nauman, what are your observations on attitudes before and after, and maybe touch on investments and broader trends?
Yeah, no, look, I think one thing that I've noted is called a behavioral shift. I think since COVID, people have, as a general rule, become a bit more focused on balance, quality of life. You know, as you both, I'm sure, know, in major cities at least, it was a massive push out. People wanted space. I think part of it was for health reasons. Part of it was simply because they started to, I think, balance the prioritization of what matters to them outside of the 9 to 5 and the 5-day work week. So I think that's one aspect that I think was a clear a result of COVID, and I think it remains, right. There's still this phenomenon of flexibility, flexible work schedules. People want to have the option to work from home, see their families more often, and that may or may not be directly healthcare related, but there's a link, right? I call it emotional well-being, family well-being. And trying to find a way to balance priorities, maybe more so than they did before. And as difficult as COVID was for a few years, I think that might be the silver lining a bit, where I think attitudinal shifts have changed. Look, I'll tell you from a banking perspective. Prior to COVID, the idea of not being in the office 5 days, it didn't really exist. And now majority of bankers have a level of flexibility. I think one of the concerns maybe just culturally, and I'm just speaking for banking in particular, it's a fairly intense industry, and if you aren't there with your colleagues 5 days a week, will people be able to retain that and maintain that? And I think for the most part, people have certainly done so, but they also they save an hour, 2 hours or more commuting, and they have that time with their families. So call it a well-roundedness and overall well-being has been one of the positives.
And Harshit, you've already mentioned this, but technology is probably a greater influence. Tell us about Docere, and tell us about how that is maybe accelerating transparency and accessibility for broader audiences to healthcare and drugs.
So our business in particular benefited a lot from the pandemic. We launched at the beginning of pandemic, where adoption to any digital initiative, the barriers to adoption were at an all-time low. So our typical master service agreements with pharmaceutical companies, which used to take like 12 to 18 months, were done in like 2 to 3 months, right, in a record time. And because pandemic stayed for a long time, there was a long time to change behavior of marketers towards adoption of a new channel, which they had not trusted before. But when they experimented with that channel in the new reality, it kind of worked for them. And in the post-COVID era, although there was a kind of tendency to bounce back to the pre-COVID era, but a lot of it survived, a lot of it sustained, because that became the way of life to work, right? But as part of that, if you see some trends, for example, telehealth, right? Telehealth became so popular during the COVID phase, but after that, it declined massively. right? A lot of telehealth companies have shut down as well. There are only very few indications in which telehealth still continues to play a dominant role, right? This is about, I think, some trends that we have seen, like coming to our business, right? So pharmaceutical companies are a little slow to adopt any new initiatives, and digital is one of them. When the consumer brands spend about 70% of their advertising budget on digital, pharmaceutical brands used to spend less than 5% of their advertising budget on digital, right? And they were spending most of their monies on traditional sales and marketing channels, right? Hard for them to change, but pandemic helped. And as Docare, we help pharmaceutical brands and their agencies to do hyper targeted messaging to healthcare professionals in professional environments. What does that mean? It means when a physician is in front of the patient, he's thinking about a patient, he's thinking about a therapy, he's thinking about making a decision of therapy for the patient. Those are the moments where our platform can help brands advertise or communicate effectively to physicians, right? So very niche, very targeted area, but improves the opportunity of conversion significantly when a physician is not in that mindset that conversion doesn't happen, right? And that's what we help pharmaceutical brands in effective conversion from their marketing efforts.
I think it's such an interesting business model, and the statistic that you lay out, Harshit, tech versus healthcare, 70% versus 5. I mean, it's astounding, but it's not surprising when you say that, right? I think medical professionals tend to be a bit risk averse and not necessarily technologically inclined, right? So it does add up to me. But also, I find the business model just quite fascinating because it creates efficiency in a market which is incredibly inefficient before, right? It's almost doctor by doctor, outreach. So you can see the upside here being amazing, and it's one of those aha moments. Like, why hadn't somebody thought of this before, right? Because it's brilliant and it's fairly simple at its core, right? When you think about what you're doing, yeah, very interesting.
Yeah, no, thank you. And this is one of our goals to improve the efficiency and effectiveness of this marketing channel. And we believe this has a potential to impact the cost of healthcare.
What were the major barriers that you overcame? Because as Nauman said, it's kind of obvious when you hear that it's done and you wonder why it wasn't done before.
So I think any new business, right, faces a lot of barriers in terms of a new brand entering a market. But as I said, COVID helped us immensely, fortunately or unfortunately. It helped in lowering most of the barriers, and people did try, right? And all of the trials are never successful, but those early adopters did try and continued, helped us in improving the platform, the initiatives, which led us to reach here, right? In like 4 years, we are now a 220 people brand with network in 21 countries, offices in 4 countries, right? And growing at a very rapid pace, 3x year on year, right? Shows that our solution is working, helping pharmaceutical brands, helping healthcare professionals get the right message at the right time.
Nauman, tell me about what it is you do, and also maybe give us some flavor of what some of your clients are doing with the commercial bank in terms of embracing these new opportunities for healthcare.
My role as the head of healthcare for the commercial bank is essentially to support our mid-cap clients in healthcare space, broadly speaking, across the various healthcare subsectors on a global basis. Citi of a reach which really is unmatched. So the goal of the function is to do exactly that, support the right clients, help them grow, usually where there's an international opportunity, because that's where we really stand out, and our capabilities are probably are amplified in terms of what we can really do. So a big part of the job, which I found interesting, and I've only been here 8 months, but a big part of the reason why I took the job was the opportunity to work with innovative companies. To me, the mid-cap space is that, a lot of larger companies are fairly established in what they want to do. There's innovation to a degree, but not necessarily like this, right? Here, essentially, we're creating entirely new business channels. And I think that's fascinating. So, we have, even within Citi, we have an entire team, the team that Harshit would work with, which works with what we call emerging corporates, right? These are companies that are on the small side, but they have potential to grow and become quite influential and change markets. And often we're finding where it is called a combination of healthcare and with a tech angle to it, right? Because that is sort of the wave of the future. And Harshit's company is exhibit A of that. So very exciting work, a lot to be done, very innovative. And it is global as well, because certainly innovation is not limited to just the US. I mean, as Harshit points out, his operations are in Asia, are in India, are in Europe, and expanding even more broadly. So the potential is fantastic, and for us, it's always exciting to come across businesses which are innovative and creative, and where we can provide a service which is unique and truly value add.
Building on this, I'd like to talk about this first pillar that the World Economic Forum talk about, of equitable access. Harshit, I know you have experience in the past from your advertising days. Maybe you could tell some of those stories of using innovation. The bracelet story, I would love to hear you tell, because I think this encapsulates greater access and greater outcomes by not necessarily using traditional methods.
Absolutely. And access, right, is one of the most important areas in healthcare which needs support. In fact, I supported that during my advertising days in my previous stint, and we're supporting that even now, right? Like if I start with present, right, look at how a lot of patients don't get access to medicines, right? Pharmaceutical manufacturers, they struggle a lot. They do special programs in providing access of drugs to patients, but there are perceptions, right, about a drug that I cannot afford. So they don't even show up at pharmacy to find out, right? And there are numerous other challenges which are there. You would have heard of all these coupon programs, cash discount options, which are available. And if you just Google, you will find a lot of websites where you could just download those coupons and show up at pharmacy and get those discounts. But there is not much awareness about those programs as well. And often, so as Doceree, we came up with a program of using a physician to communicate the availability of those programs so that patients can potentially benefit from those programs, and we're able to provide better and equitable access. Now, going in the past, your favorite campaign, my favorite as well, Immunity Charm. I was very proud of leading this campaign. Interestingly, this idea started with my son, who was 2 years old that time. And we realized that both my wife and I, we used to make him wear a bracelet, a black bracelet, right? And wherever he would go, he would not step out of the house without that bracelet. And then when I challenged myself, why am I doing this? Right? It was more of a cultural tradition, which was meant to protect him from evil energies. Right? Then I started researching about that cultural tradition, and I found out that this is prevalent across all of Asia. Then I used to work in advertising. I thought, wow, this is such a strong tradition. Could we use it to solve a health problem? Then came across immunization and came up with this idea that every time the child gets immunized, can the healthcare professional add a corresponding colored bead to that bracelet, so that this bracelet actually becomes a vaccination card for the child, which the mother will never lose. Right? The vaccination card is lost in a lot of countries, but the bracelet stays. So in a world where data was collected on a cloud, we collected data on a thread. And the campaign was hugely successful.
Such a simple idea. And I think it plays to my next question, Nauman, of the kind of balance between prevention and cure. Healthcare, for me, when I was young, it was always about curing disease, curing ailments, but you can't move now for dietary advice and health advice. And from your perspective and your research and your clients, do you think there's a good balance between the organizations that you serve in looking at both sides of the prevention and cure?
So, Jordan, I think you've hit the nail on the head. Over a pretty short period of time, 10, 20 years, we've really shifted from cure post fact to trying to prevent issues from materializing, or it really comes down to best quality of life, right? And so many of us, right? You have your watch, you have your fitness ring. It's about checking your health statistics, making sure that you're as healthy as you can be, because ultimately it isn't just the number of years that you're on this planet; it's the number of healthy years that you're on this planet. And I think that is a phenomenon that is growing and growing. And there's a skew towards greater access to call it preventative medicine, and there's greater access to awareness of your own mortality, your own preconditions for whatever medical conditions that you might have. But this will be a phenomenon that I think continues to grow over the course of time. And look, ultimately, from a provider perspective, it's important as well. The earlier you can find an issue, prevent the issue, or reduce its impact from a pure dollars and cents standpoint, that's meaningful as well. So I think it benefits certainly the patient, the person, and I think it benefits the broader called healthcare ecosystem as well in the long run. It will take time, I think, broadly speaking, for adoption and access in emerging economies, but it will get there in due course, right? Access to platforms, access to tech, where people can, determine their own health data, number one. And the second point, I think, would be a cultural shift where there's actually a focus on it, the focus on health, focus on wellness, focus on, maintaining a good diet, etc.
What are your observations on this, Harshit? Prevention versus cure, and also, is it just a developed market? Is it rich countries can afford to do this when maybe less endowed countries can?
I have a little controversial point of view there, because as a doctor, as a physician, I practiced in India and in the United States. And as a patient, I experienced healthcare in India, in London, in Singapore, in Japan, and in US, right? And that kind of, I think, a unique point of view there. When I was when I went to medical school in India, right? I was very passionate about doing my higher studies and residency in US, and that's how I landed in the Northwestern University. But after practicing, I realized this is not what I want to do. Because I was thinking at a spinal level. I was not using my brain a lot. I thought my brain neurons will atrophy if I continue working in this market, because everything is kind of driven by the legal and the insurance systems. I don't have to use my brain. If a patient with pain abdomen comes in, okay, order CT abdomen, right? I want to use my intellectual capability, my experience to diagnose, right? And use technology to support that diagnosis to help the patient, right? While the practice has gone the other way, right? Because everyone wants to save their skin, legal, right? And all that stuff. That's one perspective, right? On how I feel the technology, a lot of access has not necessarily taken the healthcare, right? The real care in the health in the right direction. Second point on access, right? Again, same example. If I get pain in the abdomen, and let's take example, pain in the abdomen when I'm in Delhi, pain in the abdomen when I'm in London, and pain in the abdomen when I'm in New York, right? Easiest access to care I will get in New Delhi. I can go to a hospital, I can meet a doctor in 30 to 45 minutes. I can get a medicine and I can be relieved of my pain in 60 minutes, right? While both in London and in New York, it will take several hours just to get access and the right treatment, right? If I go with that example, which I'm sure both of you would have experienced as well, like, where is access better?
Interesting, fascinating.
Can I ask a question on that? If you don't mind, so no, that's really interesting, Harshit. So, out of curiosity, is that in India? Would you feel that that access is available for the average person, or is it a person of means who can pay, significant sums, which others may not be able to do?
Great question. Right? So, for an average person, yes, access is available. I think for people for whom healthcare is hard to afford, for those people it will take a little time because government facilities are always overloaded. But healthcare, like in emerging countries, is not that expensive.
What's your perspective on this, Nauman? So if this surprises you from a Citi global perspective, how does Citi view the disparity between services? And, Harshit talks about the kind of almost the constipation in some markets of being able to access healthcare and the legal constraints.
Yeah, I mean, look, I think we all know that there's no perfect system. The U.S. system is incredibly complicated, very expensive, and of course, you can get the top of the top quality of care in certain cases, but it is very expensive, and insurance is absolutely critical, and insurance is not available for everyone. There are a number of challenges there. In Europe, in the UK, for example, as Jordan, as you fully know, it tends to be a bit of a balanced system where you have the NHS, which I think it serves an incredible service, and I think it does really well. But oftentimes people have private insurance on top, and I think that system works reasonably well. When I've needed to get medical attention, or my family has, it's been effective for us. And in a lot of the emerging economies, there is this discrepancy between, private hospitals and certainly what's available for the masses, for lack of a better phrase. And that's always interesting. I think people of means, and I think, to Harsh's point to a degree, you don't necessarily need to be wealthy. Just, if you are of reasonable means, probably have access to good quality medical care relatively quickly. But I think where the challenge still lies is for the average person.
Harsh, I'd like to explore your distinction, which I think is a very good one, between health and healthcare. I read recently that there's a bit of a human resource crisis related to healthcare. I mean, we certainly hear that in the UK all the time. Is this a world that people are attracted to join, do you think, still? Is technology reducing their ability to make an impact, or the controls that you talked about earlier of, is it such a strict process that it's stopping smart people from joining because it's not very flexible?
See, I don't think technology can ever replace a healthcare professional. Neither you would be comfortable in handing yourself to a robot versus a human being, right, for operating a procedure. Technology is an enabler, right, for all of us, and similarly for healthcare professionals as well, to make their life easier and better so that they can treat their patients even better. So I don't think they're getting replaced, and that may not be the primary reason for the shortage of healthcare professionals all over the world. I feel it is about the attractiveness of the profession, which is what I feel is kind of changing or even aggravating this problem. Because a lot of people I know, they join healthcare or they become medical doctors or healthcare professionals just to help other people, right? In a lot of countries, right? I have seen motivations at different levels. Like my wife, she's a pediatric hemonc, and I've tried to convince her multiple times, why don't you move on the other side of healthcare, the business of healthcare? And she said, I don't want to, right? I want patient care. I like patient care, and that's what I want to do, right? But if you see the expectation on the other side from us as patients, we look at it as a business, right? Hospital is a business, right? Private hospitals, they make money, right? And again, this is more of a global perspective, not an emerging or a developed market, but as a patient, that's the expectation. So I feel there's an expectation mismatch, which is kind of leading to dissatisfaction in the overall community as a whole, leading to less interest in the profession, right? So that's one perspective. But another perspective I see is that the number of healthcare professionals that exist in any country uh, is much more than the reported number, right? There are a lot of alternate systems of medicine, right? Like we look at homeopathy, right, in Germany and other countries, or the Chinese system of medicine in China, or Ayurveda in India. There are a lot of trained healthcare professionals who are actually treating people. Their census is never counted in the number of healthcare professionals in that country, which kind of may not be leading to the right number.
Nauman, same question to you. Do you think there is a human resource crisis for people supporting healthcare? Is it as attractive as it used to be? The old adage was that every mother wanted their child to be a doctor when they grew up. Is that still the case?
It's interesting that you said that my father is a cardiologist, and there was always an not explicit but implicit maybe expectation that that you would do this. Not just me, but my three siblings as well. And ironically, none of us became doctors. But I think it's a couple things, right? One, it's always been viewed as a very safe and respected profession, right? Meaning you would always have a job. For anybody who's grown up in an economy or a region of the world where job insecurity is a concern, it helped. Mitigate that to a degree. So I think that was one point. I think for people who want to become medical professionals, doctors or otherwise, they need to have a true passion for it, a calling almost. I have some relatives, cousins who are 20 years younger than me, but they're doing fantastically well in the medical profession because that's what they really want to do. To the point that Harshit made, they prefer to be a doctor and treat people or a physician's assistant or a nurse or whatever it may be, and to treat people versus being on the business side. So I think that aspect will remain. Where I think it is challenging, and my experience is maybe U.S. focused as much as anything, is it gets complicated. From a career perspective, there's litigation risk. There's reimbursement challenges. The level of training that is required is obviously very extensive, and the cost to do so is very expensive as well. So the people who want to do it and go through the entire process, incredible kudos to them, because it's a lot to accomplish to pursue a career that you want to do. But there'll always be people who want to who are focused on the greater good, who are focused on helping others, and who just love medicine. So I think that'll remain. But some of the call it the ancillary challenges are not going away, if that makes sense.
My last question to you both is: do you have a sense of optimism? Is progress being made in the world of health and healthcare? Is the world getting healthier? Harshit?
I think as I started I think all these all these devices, technology that kind of help us track healthcare are growing, right? But if you really see, the adoption of those devices only is with a limited community, right? The behavior, the innate behavior of people still is reactive, right? We might go for some preventive tests here and there, and there are always outliers in the community. I'm talking about the majority, right? We may not be headed in the right direction, and it is reflected well in all the demographic numbers and the morbidity data as well. And it is not only the person who's responsible, right? It's the environment which is responsible in that direction. So if you look at global warming, the climate change which is happening, how it is impacting like this time I heard the allergy season was really bad, right? Everyone was down with allergies, right? If you look at pollution in a lot of countries, right? So many people are impacted, but anything being done? No. Can they do anything? Some mass avoiding going out here and there. But overall, we are not getting healthier, right? We're not going in that direction. And honestly, I don't know what is the right way to get there as well. Because it's a combination of so many things that have to come together to make us healthy as a community.
Nauman, is Harshit being a realist or a pessimist there?
No, look, I think he makes some very interesting points. I view I agree with much of what he says, but I have a slightly different take. I think for first on the technology point, I think adoption will come with time. There's a ramp up period, so you will have more and more people having access and awareness to measures to monitor their health and take ownership. The way I think of it is that the people who are innately focused on well-being, on our health, will be healthier and live longer than people ever have historically. But the challenge remains that, look, I mean, obesity, morbidity rates, they're still there. These are not going away. Easy access to food, overconsumption. A lot of the, call it just societal expectations or the behaviors that people have had. Those don't change quickly. So I think that people who want to take ownership, every opportunity is there to live a longer, happier, healthier life. Developed economies have had obesity issues, many of them for quite a long time. So you need to have a level of ownership, as I call it, of owning your own health and taking care of yourself. And some of that is technological based, so you can determine, but a lot of it is cultural as well. So it's complicated, and I think if you want to do well, you can really be all over it. But there are plenty of ways to avoid a healthy lifestyle if you want.
So it sounds like, in summary, we know how to live better, but not everybody has the luxury of being able to do it, or even culturally the willingness to do it. How we can squeeze a conversation about global healthcare into just over half an hour, I don't know, but thank you for attempting to do it for me, gentlemen. It's been a pleasure talking to you. Thank you very much for joining Good Things Happen.
Thank you, Jory.
Thank you so much, Nauman.
Citigroup, Citi and Docere are not affiliated and are independent companies, though Docere has a relationship with Citi through Citi's Commercial Bank. The speakers' views are their own and may not necessarily reflect the views of Citi or any of its affiliates. All opinions are subject to change without notice. Neither the information provided nor any opinion expressed constitutes a solicitation for the purchase or sale of any security. The expressions of opinion are not intended to be a forecast of future events or a guarantee of future results.